In a quiet clinic, Dr. Lena Carter treats a patient who reports sudden cracking and loud eruptions from a molar with no warning. This rare phenomenon, called exploding tooth pain, involves gas or pressure building inside the tooth and sometimes rupturing enamel. Experts propose trapped air from decay, tiny bubbles, or nerve reactions, while others consider stress and caffeine as possible triggers. Conventional imaging rarely reveals a clear culprit, pushing researchers toward chemistry and microstructures rather than ghosts or legends. As reports grow, the mystery invites curiosity about how quirky biology can reshape our everyday reality.